Bring your knees up to here. So about about 45 to 60 degrees. It's not perfect, but I just want him to be stable. And what we're gonna do now is something called Ober's test. Anybody in here use Ober's test? One? Okay, this is a good test. So traditionally, this test was all about the IT band. It was the test for the IT band. But what you'll see in your notes is that the research does not support that. They would actually, dissect and cut the IT band and see if, there was more excursion. And the most excursion was when you cut the glute minimus and medius, or when you actually cut the joint capsule. That's when you saw the most movement. So this is basically a test for just lateral hip structures. It includes the IT band, it includes the glute min, it includes the glute medius. It even has, some aspect of the capsule. So what we're gonna do is we have to grab his foot, and he's kind of far from me. This is the moment. Can you scoot towards me a little more? Make your life easy. This is way better. Now, we need to be really mindful and continue to ask for permission when touching patients. As you can see, I can easily bump into his rear end. I saw some fingers in places that they shouldn't be. Continue to use what we know and have learned for respecting each other, even in this environment, right? That's very, very important. No exceptions. So if you don't mind, I'm gonna raise your leg for you. And I'm gonna lift his bottom knee he's got a heavy leg, so I have to be careful not to hurt myself, right? And I'm gonna trap his ankle under my armpit, and now I have him. So how did I get here? I had to scoop, so I had to grab his ankle first to make room for my hand. My hand is now here, and I can just pull back and switch to this. That's gonna be the thing you have to work on, is that transition. What we now need to go to is the hip. We have to stack hips. So if you take a pull right through his hip joint, it should go right through the other hip joint on the opposite side. We don't want him rotating back. We don't want him rotating forward. We want to stack his hips. And to maintain this, because the patient's gonna move when I go back, I need to put my hand on his hip here just to keep him from moving. And then I'm going to push-pull. I'm gonna stabilize here as I pull his hip back into extension. So one of the cool things is I'm checking hip extension right now, right? So I can kind of see how much hip extension he has. And then here is where you have to use good ergonomics, don't hurt your back, and you gotta do like a little lunge and just kind of keep that ankle under your armpit and just see how far this goes down and just eyeball it. If it does not touch the table, it's a positive test, right? So he has a positive Ober's here. Now, let's say he did not have full extension of his hip. He does, he has good extension. But if he didn't, now I need to modify this. So here, under, always go under, under, under. Don't go over, right? Stay under. This is easier for your arms, right? Scoop, be the bear, not the bird, right? So I got him here. See where my hand is? It's crossing the knee, and I can literally keep his knee extended back to stabilizing the hip, and now I can go back and I can still do this test again. And the only reason I would do it like this is because he does not have full hip extension. So if the rectus femoris is short, he won't be able to extend the hip fully. And I can't do this test. So I need to take the rectus femoris out of the equation by extending the knee. And now I can do this test. And now this test has told me something else. He also has a tight rectus femoris. I'm getting all kinds of data, okay? So that's Ober's test. And this is really a great test because when you needle these points that we're gonna do, this test is usually negative or changes significantly right away. And the patient can feel it, you can see it, and you can get, a confirmation that your treatment was helpful.